Our Children's Hospital's Solutions for Patient Safety Network has prevented hundreds of children from having catheter-associated urinary tract infections. We have compelling evidence that shows if we reliably implement our SPS prevention bundles, we will prevent harm to our patients, and we are committed to doing just that. The CAUTI SPS Prevention Bundle is a two-part bundle intended to prevent catheter-associated urinary tract infections. The CAUTI Insertion Bundle component of the CAUTI SPS Prevention Bundle includes the two standard elements listed. In this video, we will walk through the steps for completing this insertion bundle. For any of the procedures in this video, you should prepare a separate work surface and clean the surface with approved sanitizer prior to setting up for the procedure. Verify indication for the catheter placement. Using catheters only when clinically necessary will reduce the population at risk for CAUTI. Explain the procedure to the patient and caregiver. Make sure to verify the correct patient by using two patient identifiers. Clean your hands with soap and water or use alcohol-based hand sanitizer. It is important to perform hand hygiene immediately before and after insertion or with any manipulation of the catheter device or site. Wearing non-sterile gloves, clean your work surface and prepare your supplies. Next, clean your hands and put on a new pair of non-sterile gloves. Place the underpad under the buttock. Remove the non-sterile gloves and clean your hands. Put on a new pair of non-sterile gloves. Cleanse the perineum per your hospital's practice guidelines. Remove the non-sterile gloves and clean your hands. Open the sterile insertion kit and place the Foley onto the sterile field. Apply the drape. Clean your hands. Next, put on sterile gloves. Open the sterile supplies onto the sterile field. Clean the area around the urethral meatus per your hospital standard. We recommend a second person to assist with this procedure. While holding the catheter in your sterile dominant hand, lubricate the tip generously. Next, insert the catheter into the urethral meatus, advancing until you reach the hub of the catheter. Using the sterile water syringe, inflate the catheter's balloon. Once the balloon is inflated, gently pull back on the catheter to ensure the catheter is positioned at the bladder's neck. Using sterile technique, attach the catheter to the drainage system. Make sure the drainage bag is always positioned below the level of the bladder and that no dependent loops or kinks are present. Finally, secure the catheter to the patient's thigh at bifurcation. Allow enough slack so that there is no tension on the catheter with leg movement. You can now successfully complete the insertion bundle component of the CAUTI SPS Prevention Bundle. If you reliably implement these best practices, children at your hospital will be saved from harm. Start today. Adopt these best practices and save children from harm, one child at a time.